You need to ask yourself one question if you are wondering if becoming a CRNA is right for you. If you are only looking at money, if you are only looking at, videos and you see online what CRNAs can make and there is nothing else influencing you about wanting to join the profession, then I honestly think that you should consider a different profession. Some people have come from me before my comments about this because I made a video about this a while ago where you cannot only be driven by financial gain to do something because you will inevitably not end up being happy. And maybe some people will beg to differ. But at the end of the day, if money is your sole driving force to wanting to become a CRNA, I do not recommend doing that. There are many sacrifices involved with becoming a CRNA. There is a lot of responsibility involved with being a CRNA. It's not like being a nurse where you are not responsible for your own orders. You don't put in orders as a nurse. You do a lot as a nurse, but you do not have that overriding responsibility for the patient like you do as a CRNA. You have to carry malpractice insurance for a reason as a CRNA. There are a lot of things that can go wrong in anesthesia. There are a lot of things that you are liable for. It's a great profession, it's a great career, and I'm not trying to dissuade anybody. What I am trying to dissuade is that if you have no true, not even passion, but if you have no true interest in wanting to be a CRNA and actually wanting to administer anesthesia to patients and actually do all the skills associated with and actually carry the weight and responsibility of giving anesthesia to people and being a CRNA, if you don't have any interest in that and you are just looking at a check, there are a lot of other things because let's be real, bedside nursing may not be for everyone. It can be very draining and taxing. However, there are so many things that you can do with nursing, and being a CRNA is not the only way to make good money as a nurse. All I'm saying is please, if you are looking into becoming a CRNA and you see the dollar signs and you see, what kind of life you could live, that might be great and all, you're compensated very well, etc. But if you do not truly have an interest, I didn't say passion, I didn't say that you have to wake up every day and just say that, oh, my only purpose in life and goal is to just be a CRNA. At the end of the day, it is a job, it's a profession, you go to work to make money, we all understand that. But if there's no drive or gain or force besides the dollar, you could also say you could go become a physician and make a lot of money. You can go do engineering and make money. You can go work in tech. Like there's a lot of other jobs that you can just make money. If you don't have an interest in those things, the passion will die quickly. Keep that in mind. Obviously, they're compensated well. Look into it and make sure it's actually something right for you. That's why every school requires shadowing. And even if, let's say, there's a program that doesn't, for whatever reason, require shadowing, 100,000% you should shadow. And if there are professions that you are torn between and you want to see the difference, then shadow both. Shadow. You want to be a medical doctor, go shadow. You want to be an NP, or you think about NP or CRNA or PA or whatever, shadow all of them, because that's going to show you what it's really like. Talk to people. Don't just go off of how much money can I make and take it from there.